All right, I am Kim Laney. I would like to welcome you to our Monday Brown Bag Lunch presentation, and thank you all for being here. I am not going to start the closed captioning as I have done in the past. If you do want it, please go ahead and make a request and I'll see that and then I'll get it started. But we have had some technical difficulties, so just let me know if you want me to try and turn that on and I'll give it a go. I want to thank all of the friends of OLLI whose support makes these weekly brown bags possible. We hope you enjoy today's presentation, and we hope you will continue to help us provide these presentations by making a donation to OLLI today. OLLI membership is open to anyone in the community, and you don't have to be 50 to enjoy the benefits of OLLI membership. Membership begins each year on July 1st and runs through June 30th each year. If you are already a member, please invite your friends to join. One frequently asked question that we often get is how to find the brown bag recordings on our website. So I wanted to let you know that following the presentation, we'll make the recording available, and you can just navigate to our website by going to either the news and events or just right there in the middle of the homepage. Then once you navigate there, you can find the brown bag presentations by clicking on the archive at the bottom. We're just about ready to get started. And if you haven't already, please mute yourself. And you can unmute yourself when asking questions. John would like to take questions after his presentation, and he's going to break it up into a couple of different sections. So you'll have time to ask your questions, but you can also put them in the chat so that we can have those questions ongoing throughout the presentation. Thank you all again for being here, and we're going to have Jane go ahead and introduce our speakers today. Thank you.
And we're happy to welcome all of you as attendees today, and also our speaker, John Schumann, who's been a volunteer with the Alzheimer's Association since January of 2020. He's a community educator and is also on the Walk to End Alzheimer's Planning Committee. He enjoys educating the community and raising awareness about Alzheimer's disease and all other dementia. So we look forward to this talk. John, it's all yours.
Thank you. I'm going to do this right this time. Make sure we get my screen shared. Yeah, I just want to make sure that we are going to hear the sounds there. So we'll be connecting. If I could just get a acknowledgement that you're able to hear the music through.
You can hear the music.
Excellent. Well, I'm excited to do this presentation for you because while I'm fortunate enough to be retired, my passion was in learning and development, and I had been a manager for Staples fulfillment centers in learning and development, where we stress lifelong learning. So it's really a pleasure to be able to do a presentation with you today. As I was introduced, I'm a community educator. I'm based in Sacramento, California. I work for the Northern California and Nevada chapter. So again, it's an honor to be able to present to you. I want to welcome you to this. We're going to do two presentations today. They are cut down to normally about an hour. These presentations were prepared to make the most out of your time and be able to do these lunch gatherings. So you may see me skip ahead in some slides, so you're not missing anything. We're just staying with the reduced presenter's guide that we have going there. So this program is designed for those who want to learn more about the warning signs of Alzheimer's and other dementias, and those who have noticed memory or thinking changes in themselves or others. Throughout the presentation, you'll see a number of videos that have taken place in various settings. Please let me know if you have trouble hearing them as we go through. And let's take a look at what we're going to be discussing today. Again, if you have any questions, please use the chat box. We can make sure we don't miss someone's question as we go through the presentation. Today, we're going to explore the most common warning signs of Alzheimer's to help you be informed about what normal aging is and what it is not. And by the end of today's program, the goal is for you to be able to describe typical age-related memory, thinking, or behavior changes, recognize common warning signs of Alzheimer's and dementia, discuss the tips for approaching someone about memory concerns, explain the importance of early detection and benefits of diagnosis, identify possible tests and assessments for the diagnosis process, and we'll be covering in the second half of the presentation the resources available through the Alzheimer's Association. So we're all here to learn more about dementia and Alzheimer's and identify common warning signs of the disease. You may have heard the terms dementia and Alzheimer's used interchangeably. While they are related, there are significant differences between the two. Let's hear more about this from some Dementia Association experts. First, Dr. Heather Snyder is going to discuss what dementia is.
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow and the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual, but there is also some overlap in behaviors among the types of dementia.
Alzheimer's is the most common form of dementia, accounting for more than 80% of all cases. In this next clip, we're going to hear Dr. Dean Hartley explain to us what the disease is and what it looks like in the brain.
More than 100 years ago, Dr. Alice Alzheimer's described specific changes in the brain, what we call the formation of plaques and tangles. Now, Alzheimer's is a progressive brain disease that's marked by these key changes and is thought to impact memory, thinking, and behavior. The brain has three main parts: the cerebrum, the cerebellum, and the brainstem. Each one plays a role in how the body functions. The cerebrum fills up most of your skull. It is part of the brain most involved in remembering, problem solving, thinking, and even feelings. There are about 100 billion nerve cells or neurons throughout the brain that transmit messages in order for us to create memories, feelings, and thoughts. Alzheimer's disease causes nerve cells to die, which leads to the brain tissue loss, or what we call shrinkage, and causes loss of function and communication between cells. These changes can cause the symptoms of Alzheimer's disease, such as memory loss, problems with thinking, planning, behavioral issues, and even at the end stages, problems with swallowing.
And lastly, we'll hear from Ruth Drew, the Director of Information and Support Services at the Alzheimer's Association, about the importance of recognizing the warning signs of Alzheimer's.
It's important to know what the warning signs of Alzheimer's are and to be on the lookout. We know that we change over time, and the warning signs of Alzheimer's can be warning signs of a number of things, but when you see those in yourself or in someone you care about, it's important to check it out, to consult with a doctor, to find out what you're dealing with.
As Ruth said, it's important to know what the warning signs are and to be on the lookout for these marked changes. The Alzheimer's Association, as a leader in this area, developed a list of 10 warning signs to help people understand the differences between normal aging and common signs of possible dementia. The list is intended to be a tool to help identify unusual changes in a person's memory, thinking, or behavior. It's important to note that this does not constitute a diagnosis of Alzheimer's or dementia. These are simply the most common examples of changes experienced, and individuals may experience one or more of these signs in different degrees. Now we're going to explore the signs and what are some of the typical age-related changes. In the first sign, we look at memory loss that disrupts daily life. One of the most common signs of Alzheimer's, especially early on, is forgetting recently learned information. Others include forgetting important dates and events, repeatedly asking the same questions, and increasingly relying on memory aids memory aids or leaning on others for things or tasks that you once handled on your own. A typical age-related change is sometimes forgetting information, but we remember it later. The second warning sign we cover talks about challenges in planning or solving problems. Some people may experience new difficulties in executive functioning, including developing or following a plan or difficulty concentrating. Conversely, a more typical age-related change is making occasional errors when managing bills or your household finances. The third warning sign we talk about is difficulty completing familiar tasks. People living with dementia often find it hard to complete daily tasks that used to be managed with ease, such as driving to a familiar place, writing a grocery list, or remembering how to play a favorite game. Conversely, a typical age-related change would be occasionally needing help to use a microwave or remote. This could also include having trouble with new technology that the person hasn't had the opportunity to engage with as frequently. In our fourth warning sign, we look at confusion with time or place. An individual living with Alzheimer's or another dementia may lose track of dates, seasons, or the passage of time. They may have trouble understanding something if it's not currently happening, or become confused about where they are or how they get there. This can become more dramatic or profound in the middle and late stages, and a more typical age-related change could be getting confused about what day it is or when the scheduled appointment is, but we figure it out later. In the fifth sign, we look at trouble understanding visual images and spatial relationships. Some individuals with Alzheimer's or another dementia may experience vision problems, which can lead to difficulty with balance, trouble reading, and problems judging distances and determining color and contrast, which can impact driving and navigating the environment around them. Vision changes such as cataracts are a much more typical age-related change. And this sign shows us that these changes are not just about memory. It's important to think about all the ways that someone's daily life may be impacted by any of these changes. In our sixth sign, we look at new problems with words in speaking or writing. Individuals may have trouble following or joining a conversation, stop in the middle of a conversation and forget what they're talking about and continuously repeating themselves. They may also struggle with finding the right word or calling things by the wrong name. And they may start using more descriptive terms to talk about something rather than the name of the actual item. A normal age-related change, however, would be occasionally having trouble finding the right word. And this was one of the signs that we noticed. My mom had Alzheimer's and passed in 2002, and where she would be in the middle of her conversation and just kind of stop and get stuck for a minute, and then would either move on or remember what she was talking about. So these signs are excellent for help identify possible changes in our brains. In warning sign 7, misplacing things and losing the ability to retrace steps. This sign often causes concern in people, and I want to clarify that this is not about just losing your keys on occasion, misplacing things from time to time, but retracing your steps to find them is a normal age-related change. A person with Alzheimer's disease may lose things and not be able to recall when it was last seen or identify the location it was placed, or he or she may be putting things in unusual places, such as putting your shoes in the refrigerator. Because of the lack of executive function and awareness, the person may grow increasingly suspicious of others and start accusing others of stealing and do so more frequently over time. In the 8th warning sign, we look at decreased or poor judgment. Individuals may experience changes in judgment or decision-making, such as using poor judgment when dealing with money or paying less attention to hygiene and grooming. This can be especially common in individuals who live alone. Making a bad decision once in a while, such as forgetting to get an oil change, is more of a typical age-related change. In our 9th warning sign, we look at withdrawal from work or social activities. As we age, it's normal to feel uninterested by family or social engagements at times. However, someone who is experiencing dementia-related changes may start to lose their ability to hold or follow conversations, and as a result, begin withdrawing from social encounters or hobbies. They may also lose confidence to engage in this way. And the 10th warning sign we look at is changes in mood and personality. Individuals with Alzheimer's or another dementia may become confused, suspicious, depressed, fearful, or anxious. They might get easily upset either at home or when out of their comfort zone. As we age, however, it's normal to develop very specific ways of doing things and becoming upset or irritable when our routine is disrupted. Someone with Alzheimer's or dementia may become fearful, angry, or easily frustrated, which is something that should be addressed early. Our next topic is the importance of early detection. It's key that we pay attention to what's going on within our own cognitive health and not dismiss any changes that we may be experiencing as normal aging, as well as that of others around us. Any change that's unusual for your level of functioning or that of someone around you may be a cause for concern. Many times, friends and family are the first to notice the changes in someone's memory, behavior, or other abilities. And in this module, we'll discuss why it's critical to address the observed changes early and to seek answers from medical professionals. Sometimes the person exhibiting symptoms isn't aware or may not have the insight to know that they're experiencing changes, which is why having outside perspective is critical. This is especially important for individuals who live alone or far from family and friends. We're going to listen to Dr. Salloway as he discusses this and then hear from a care partner who was the first to notice changes in her husband. So first, Dr. Salloway.
You know, it's a very interesting phenomenon that people who have memory problems are often less aware of it than family members or their friends who know them well. One of the reasons for that is our ability to monitor ourselves, which is an important part of brain function, decreases when we start having memory problems. Not in everybody, but commonly, and more than half the people with memory problems. And so the person is just not keeping track of the trouble they're having day to day. But the family members are, you know, paying attention. If they're paying attention, they see, boy, this is starting to happen a lot, and the person's not aware of it. So the family's more aware, and they may talk to their loved one about it, and they say, you know, I've noticed you've been repeating yourself. And they say, I'm not repeating myself. And that could either be due to the fact that they're not aware of it, or they may not want to acknowledge it.
Next, we're going to hear what Mary noticed.
I was so adamant about what was happening to Daryl. I wasn't sure. I didn't know. And this wasn't the person that I know. This wasn't the person. Daryl was my husband was very, he always had to be building or designing or working with his hands. And it was getting to the point where he wasn't, and he was becoming very frustrated when he was forgetting to do things or go places.
So you've come across someone who you're concerned about that there may be some changes going on. What do you do if you notice these changes? If you continue to observe these changes, it's critical that you plan to take the next step and have a conversation with the person or others close to him or her about what you've noticed. This can be a difficult and uncomfortable conversation to have, and the Alzheimer's Association has developed a roadmap of 10 helpful steps to help you make addressing your memory concerns less daunting and more productive. Let's take a look at those. So the 10-step approach is broken up into 3 segments. First, assessing the situation, then having the conversation, and the last part, the third part there, is reaching out for support. And we start by, catch me on the wrong click there. So the first step we want to do is look at what changes in memory, thinking, or behavior do you see? What is the person doing or not doing that is causing you a concern? Remember, these first few we're talking about assessing what's going on. In the second step, what else is going on? There may be various conditions that can cause changes in memory, thinking, and behavior. Are there other health or lifestyle issues that could be contributing to these changes, such as stress, diabetes, or any changes in medicine? In the third step, we're assessing learn about the signs and benefits of an early diagnosis. You've taken that very important first step by joining us for this program to learn about these topics. Do you notice any of these signs in the person that you're concerned about? And then we want to confirm, has anyone else noticed the changes? Talk with friends and family. What, if any, changes have they noticed? So we've completed the assessment part. Now you have to prepare to have that conversation. And that can be a difficult process. So when we look at that, the fifth step that we talk, and now we're into having that conversation, is who should have that conversation to discuss the concern? It could be you, a trusted family member or a friend, or a combination. It's usually best to speak one-on-one with them so that the person doesn't feel threatened or ambushed, but use what you know about the person to judge what approach might work best with them. Then look at when and where should this conversation be held. It's important to have a conversation as soon as possible. In addition to identifying the date and time, you should also consider where the person will feel the most comfortable. So then we have to look at what will you or the person that you're having a conversation with say. You want to build out somewhat of a script and consider following some questions. Some examples. I've noticed, state the change in you. I'm concerned. Have you noticed this? How have you been feeling lately? You haven't seemed like yourself. Or I noticed you, insert a specific change in example. You haven't seemed like yourself, and it worries me. Does anything else like this happen? And in the 8th step, we look at offer to go with that person to the doctor. Ask the person to see a doctor and offer to accompany them. Try using encouraging words, such as, there are a lot of things that could be causing this. Let's see if the doctor can help us figure out what's going on. Or the sooner we know what's causing these problems, the sooner we can address it. Or lastly, I think it would give us both peace of mind if we talk to a doctor. In the 9th step, if needed, we may have to have multiple conversations. Don't get discouraged if the first conversation is not as successful as you had hoped. Write down notes about how it went so that you can prepare for any future conversations. And don't dismiss the changes you're noticing simply because the person is reluctant to address them or the conversation didn't go as planned. And so we've assessed the situation, we've had the conversation. Now the next step will be we got to reach out for support. You can turn to the Alzheimer's Association. You can call our free 24/7 helpline to talk with master's level clinicians who can provide you with reliable support and information, including about how to have that important conversation. And finally, we want to see a doctor so we can rule out try and refine what's really going on in the situation. Most people address concerns about memory, thinking, and behavior with their primary care physician first. However, in some cases, the primary care physician may refer the person to a specialist for further evaluation. Some examples are on the screen in front of you. Geriatricians who have additional training in medical care for diseases and conditions common among older adults, generally over 65. Or you may be referred to a neurologist who specializes in the disease of the brain and the nervous system. If you are sent to a neurologist and your concerns are about dementia, it's important to note that all neurologists don't specialize in Alzheimer's or other dementias, so you want to make sure you're paired up with one that is able to address those concerns. You may also see a neuropsychologist who can assess, diagnose, and treat psychological disorders associated with brain-based conditions, or a psychiatrist who specializes in disorders that affect the mood or the way that the mind works, or a psychologist with special training in testing, memory, and other mental functions.
There are a number of benefits.
So then we want to look at, excuse me, while we progress to the correct slide, seeking a diagnosis. So let's take a look at what may be involved in the medical process to determine the cause of symptoms. And we'll start by testing your own knowledge. So we have some questions that we're going to do. They're going to be true or false. If you want to participate, I encourage you to put in the chat room either a T or an F based on the question. And our first question, who here thinks there is currently no way to diagnose Alzheimer's or dementia? Do you believe that there's no way to diagnose Alzheimer's or dementia is true or false? And I'll pause for a moment here, or if you want to shout it out. All right, we're seeing some falses come through. Okay, thank you for your participation, and you are correct. This answer is false, contrary to an outdated belief that the Alzheimer's diagnosis can only be made at autopsy. There are a number of assessments and tests that make it possible for healthcare professionals to diagnose Alzheimer's and dementia with a high degree of certainty. However, determining the cause of dementia can sometimes be more difficult. Here we're going to explore possible steps in the diagnostic process. Please keep in mind that as we review these steps, not everyone may be asked to undergo the same things by their doctor. Assessments may include looking at your medical history, conducting a physical exam, screening for depression, and interviews with those close companions. Tests may include, you may be sent for lab tests, mental cognitive status tests, or brain imaging. Many people wonder, do dementia-like symptoms always result in the diagnosis of Alzheimer's or another dementia? The diagnostics process will vary from person to person depending on the individual's specific situation and what the doctor feels is the right course of action for that person. The diagnosis may be something other than Alzheimer's or another dementia, and that's why it's important to investigate the cause of the symptoms. And the stigma and misconceptions about Alzheimer's, like nothing can be done, can deter some people from seeking the diagnosis. And so we're going to see this same segment of information in the second half of the presentation. So I'm going to stop here and go to questions. And I saw there was one in the chat box, at least one. The question was, how can one distinguish from the effects of being locked alone inside for a year and doing a lot of weed? So, I mean, I'm a volunteer, I'm not a professional, so I may not give you the specific answer that you're looking for. But what I would recommend would be, try and eliminate the weed part and see if there's any changes. If that's not possible, get in and see your primary care physician and start that discussion about what may be necessary. And you also can call the Alzheimer's Association helpline for questions as well. Next question was, there's enormous burgeoning retirement age demographic here. Are there any neurologists? Are you talking about in the group today, or was there something more specific for me if I could get a little bit of assistance with that? The third question I see here is, how do you distinguish dementia from delirium associated with being in a hospital setting? That's a very good question. Unfortunately, it's a little bit outside of my expertise to do that. So I would encourage you to call the helpline or visit the Alzheimer's Association website, which I'm going to share with you at the end of the presentation to show you where there may be avenues for information there. There's a question, are there any doctors in Humboldt? When we go into some of the sites about seeking care in the local community, we may be able to get you a link that will help you with that one. Any other questions? Okay. You can still add, if you come up with a question, add it in the chat box and we'll cover that.
John, I see Ted has a question. He's raising his hand.
Oh, I would say I can't see the screen, so thank you for your help on
Ted,
that.
do you have a question? You unmute yourself.
My question is, how do you distinguish dementia from delirium associated with being in a hospital or other strange setting, unusual setting, where you're disassociated from your day-to-day reality?
Right.
Drugs, things like that, anesthesia.
On those, I would refer you back to your physician, your medical provider, and try and get information there. Also, you call the helpline and put that question to them, and they maybe point you to either information that would help you with that, or be able to put you at least in the direction of the information you're trying to find. I hope that helps.
Yep, Ted has a question.
Ted.
If you actually determine that the Alzheimer's is in progress, is there anything to do to stop it?
No, at this time, there is no cure for Alzheimer's. We're looking for that first patient. Unfortunately, that hasn't happened yet. Now, there are some drugs we're going to cover in the next half of the presentation that talk about helping to improve quality of life and slowing down some, trying to give you the best life possible until the Alzheimer's takes over. But there's no cure right now.
I couldn't tell. Bert, did you also have a question? No, it doesn't look like Bert does, but I do see a couple more in the chat now.
So I see, back up a little bit. My father and sister both passed from Alzheimer's. Does Alzheimer's run in families? Yes, it can, and we're going to talk about that in the next half here. We're looking at risk genes would be where you have members in your family have had that put you at a higher risk, and there's deterministic genes, which if you have that, then you're pretty much definitely going to have Alzheimer's. So we'll cover that in the next presentation. Has our COVID isolation increased these types of mental problems? That's a good question. I know there's been concerns about the isolation with folks that have had, in their struggle to just, the social aspect of getting out and seeing things. I don't have a solid answer on that. I know it's a concern. Again, the helpline would probably be the way to go with that. I'm sorry if I got to direct you there, but I'm not an expert in all the aspects of Alzheimer's. I'm doing the best I can to get you in the information you need. Then the next question was, can you please address anger and how it works with these loved ones? Well, that's a great question. When Alzheimer's starts to take a hold, one of the things that we talk about is you may see changes in personality. If you have someone who's really angry all the time, they may turn into a really nice, sweet person, and vice versa. If someone is very gentle, as Alzheimer's takes hold, they may become more angry. So each person goes through Alzheimer's in a unique way. There's not really a cookie cutter way that I could answer that for you. Again, if you have a specific question, I want to make sure you have the helpline, and then we're going to go through some of the websites that are going to be addressed in this next presentation. That hopefully will give you a place that we can get you some help too. Where can I get the first list you showed in the symptoms of Alzheimer's? I'm going to go over some handouts. Let's keep that one fresh, and somebody please make a note to remind me of that. We have some handouts that we're going to make available to you as well, and the 10 symptoms is part of that.
Thank you.
There are specialists who have presented protocols for addressing Alzheimer's, such as Dale Brinson's protocol and David Permiter's work in the area. Do you recommend people look at such material? I'm not familiar with that, but anything that you can get as far as information that will help you have that conversation with your medical providers, I would strongly encourage you to review and bring those questions up. Okay, so that takes us about 30 minutes. I'm going to go ahead and jump into the next half where we talk about understanding Alzheimer's and dementia. If you have questions, I don't want to shut you down, so let's put them in there and then we can capture everything at the end. Okay. So this presentation, Understanding Alzheimer's and Dementia, is an education program presented by the Alzheimer's Association. And this program is designed for those interested in learning more about Alzheimer's and other dementias, and features information from dementia experts and the perspectives from individuals living with dementia and care partners. Let's take a look at what we're going to talk about in this section. Today, we're going to take that top level look at Alzheimer's and dementia to give you a broad understanding. And by the end of the program, the goal is for you to be able to compare Alzheimer's and dementia, recognize how Alzheimer's disease affects the brain, list the risk factors of Alzheimer's disease, identify the 3 stages of the disease, recognize current FDA-approved treatments that can address some of the symptoms of the disease, describe how scientists are working to advance research,
You be a good boy.
and name the resources available through the Alzheimer's Association. Okay, so we're going to be doing some skip here, bear with me. Okay, so you may hear the terms Alzheimer's and dementia used interchangeably. While they are related, there is a difference. In this section, we're going to discuss both Alzheimer's and dementia and how they're related. But before we begin, we're going to test your knowledge about Alzheimer's disease. So get yourself ready for that chat box again. We got another true and false question for you. Do you think Alzheimer's is a normal part of the aging process? Seeing some no's, false, 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 no's, no's. Oh, we have a sharp group today. False is correct. Alzheimer's disease is more than memory loss. It's progressive and fatal disease that kills nerve cells and tissues in the brain, which affects the individual's ability to remember, think, plan, plan, and ultimately function. So we're going to try another one. People younger than 65 can develop Alzheimer's. Do you feel this is true or false? Seen some truths? Okay, we'll go with the true. And that is also true. Approximately 200,000 Americans younger than 65 are living with younger onset Alzheimer's, which is also known as early onset. In some cases, people develop the disease in their 40s and 50s. Now, we're going to watch a video of our experts, Dr. Heather Snyder, explaining how Alzheimer's and dementia are related.
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow in the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual, but there is also some overlap in behaviors among the types of dementia.
As discussed, Alzheimer's is a brain disease. The brain is our most complex organ. It's also our most powerful, despite weighing only about 3 pounds. Let's hear from one of our experts about how Alzheimer's affects the brain.
More than 100 years ago, Dr. Alzheimer's Alzheimer's described specific changes in the brain, what we call the formation of plaques and tangles. Now, Alzheimer's is a progressive brain disease that's marked by these key changes and is thought to impact memory, thinking, and behavior. The brain has 3 main parts: the cerebrum, the cerebellum, and the brainstem. Each one plays a role in how the body functions. The cerebrum fills up most of your skull. It is part of the brain most involved in remembering, problem-solving, thinking, and even feelings. There are about 100 billion nerve cells, or neurons, throughout the brain that transmit messages in order for us to create memories, feelings, and thoughts. Alzheimer's disease causes nerve cells to die, which leads to the brain tissue loss, or what we call shrinkage, and causes loss of function and communication between cells. These changes can cause the symptoms of Alzheimer's disease, such as memory loss, problems with thinking, planning, behavioral issues, and even at the end stages, problems with swallowing.
Everyone with a brain is at risk of developing Alzheimer's disease. And there are a few known factors that increase a person's risk of Alzheimer's disease. Let's see if you can pick which one of these common factors is the most common. So again, we got a little test question for you. Which of these options do you think is the greatest risk factor for Alzheimer's disease? Genetics, family history, or age? And you can just use the first letter of the word if you want to use chat box to make it simple. G, F, or A. Again, a family history question. Genetics, another age, genetics. Seem to be getting, all right, so the trend is going towards genetics. Not quite. Actually, it's age. As mentioned, all of these are known risk factors. However, age is the greatest known risk factor. Now let's hear a little bit from one of our experts as she explains the most common risk factors.
Alzheimer's disease is marked by specific brain changes that result in the clinical changes in individual experiences. That is, changes in memory, thinking, or reasoning. And ultimately, Alzheimer's is fatal. The exact cause for these changes is unknown, but there are some hints as to what may contribute to an individual's risk. Age is the greatest known risk factor for Alzheimer's, and when we look at populations of people, we see an increased risk over the age of 65. However, Alzheimer's is not normal aging. Family history is also a known risk factor. Research has shown that those who have a parent or a sibling with Alzheimer's are more likely to develop the disease, and that risk increases if more than one family member has Alzheimer's. When we talk about the genes involved in Alzheimer's, there are two categories that could potentially be involved: risk genes and deterministic genes. Risk genes increases an individual's risk for developing the disease, but does not guarantee that they will develop Alzheimer's. Deterministic genes, which are rare for Alzheimer's, guarantee that the person will develop the disease.
Although Alzheimer's is not a normal part of aging, it is the greatest known risk factor. And next, we're going to take a look at some populations who are at higher risk for developing the disease. In addition to the main risk factors for the general population, Hispanics, African Americans, and women are at higher risk of Alzheimer's. And research shows that older Hispanics are about 1.5 times as likely as older whites to develop Alzheimer's and other dementias, while older African Americans are about twice as likely to develop the disease as older whites. The reason for these differences is not well understood, but researchers believe that higher rates of vascular disease in these groups may also put them at a greater risk for developing Alzheimer's. Women are more likely than men to develop the disease. An estimated 3 to 4 million American women are living with the disease today. We know that women live longer than men, making them more likely to develop Alzheimer's. However, longevity and lower death rates can only partially explain the differences. And researchers are exploring how genetic differences between men and women may impact disease risk. Again, no two individuals experience the symptoms and progression of Alzheimer's disease in the same way. Let's hear from another expert, Dr. James Hendricks, on why this is the case, as well as some of the stages, some individuals describing what it's like to live with the early stage of Alzheimer's disease.
One of the things that impacts our brain is all the other things that can happen to us as we age. And we know that Alzheimer's, the most common risk factor for getting Alzheimer's disease is age, but we also have lots of other things that go wrong with us as we age. And so how those other health factors impact our brain can also impact how Alzheimer's presents in other people.
And we're going to cover two of these. The first one I want to look at is facing frustration.
I'm like an overachiever and when you're unable to deliver or you're not performing at the same pace that you once did before, that's frustrating. It's frustrating to not know where you place things. It's frustrating to not be able to explain to someone the problems that you're having. You can't articulate it in a way. It's frustrating to read something and you forgot what you read. It's frustrating to continuously have to change your password and you just changed it last week and you're constantly doing the same thing over and over again.
And let's listen to Living for Today.
I think the thing that surprises me the most about my dementia is that it is progressive, and I'm finding that I'm forgetting more. And they do memory tests for me all the time at the doctor, and so that becomes a little disconcerting at times to see my cognitive impairment continue to decline. But again, I really have hope. I don't live really in the future. I can't live in the future. I can't worry about what the future is going to bring. I have to live for today.
Again, individuals we've heard from are living in the early stages of the disease. Symptoms worsen over time for everyone. However, people progress through the stages of Alzheimer's at different rates as their abilities change. On average, a person with Alzheimer's lives 4 to 8 years after diagnosis, but can live as long as 20 years depending on other factors. Next, we're going to hear from Dr. Snyder explain the 3 general stages of Alzheimer's disease.
Alzheimer's affects everyone differently. As a result, it's difficult to place a person in a specific stage of the disease. However, there are 3 general stages that are commonly referred to as early, middle, and late-stage Alzheimer's. In a medical context, you may hear these stages referred to as mild, moderate, and severe. In the early stage of Alzheimer's, an individual may be able to function independently. However, they may start noticing more frequent memory lapses. Friends and family may also begin to notice difficulties in the person, and a healthcare provider may be able to detect problems in memory or concentration by conducting a detailed medical interview. Middle stage Alzheimer's is typically the longest stage and can last for many years. Damage to the brain cells can make it difficult to express thoughts and perform routine tasks, and this can lead to increased feelings of frustration and anger. In the final stage of the disease, an individual loses the ability to hold a conversation, control their movements, or respond to the environment around them. Cognitive skills, that is, their memory, thinking, and reasoning skills, continue to decline, and this can lead to personality changes and need for round-the-clock care.
So we've been talking about the stages of the disease and such, and I know it was an interest in treatments. So in this next module, we're going to look at FDA-approved treatments and symptoms. We can start by seeing what you may already know. Got another question for you. So true or false? There are several drugs available to slow down the progression of Alzheimer's disease. If you would, please put your opinions there. Do you think this is a true statement or a false statement? Seen trues, seen some trues. One false, mostly trues, so we'll go with the true for you. No, not quite. There are several drugs available to slow down the progression of Alzheimer's disease. However, several drugs are available to, there are currently no treatment to prevent, treat, or slow Alzheimer's disease. Several drugs are available to address some of the symptoms. Let's hear from Dr. Hendricks about the medication.
There are currently several drugs that are FDA approved to treat the cognitive symptoms associated with Alzheimer's disease. They treat the symptoms, but they don't treat the underlying cause. So eventually people will progress, but they do treat some of the symptoms and help people for a time. So the first class of drugs are cholinesterase inhibitors. These drugs work to prevent the breakdown of acetylcholine, which is a chemical messenger found in the brain that's associated with learning and memory. There are 3 FDA-approved drugs that are in this class of drugs. There's Aricept, there's Exelon, and there's Razidine. There's another class of drugs that modulates glutamate, which is another chemical messenger in the brain that's associated with learning and memory. And this drug is called Namenda. And then there's a final class, which is actually a combination of cholinesterase inhibitors and glutamate modulator, and this is called Namzaric.
And this presentation being done before the FDA-approved Aduhelm, which is for the early onset stages of there. So there's another drug in the mix there that we can use to help with the symptoms of Alzheimer's. Because everyone experiences Alzheimer's differently, these treatments work in varying degrees and are not effective for everyone. An accurate diagnosis is important to ensure that the proper treatment is prescribed, and drug misuse can lead to negative side effects. And in the last decade, researchers have made enormous strides in understanding how Alzheimer's disease affects the brain. Many recent insights point towards promising new strategies for treatment, prevention, and diagnosis. And we look at hope. We can look at investigating early intervention.
This is an incredibly exciting time in Alzheimer's and dementia research. The advancements that we've made in the last decade to understand the disease as a continuum, meaning that the biological changes are starting a decade or more before someone is experiencing the changes in the memory and thinking. This sets the stage for possible prevention. The idea that when we have the tools to identify those individuals at the earliest time point, and when we have the interventions to target individuals at that earliest time point, we can intervene to stop or slow the progression of the disease before an individual loses their memories.
And now let's look at exploring the hope for exploring lifestyle factors.
I'm excited about what we're learning these days regarding lifestyle. One of those things that we've seen in the past are things like exercise and nutrition have now started to gain more momentum to indicate to us that it can change your ability to slow cognitive decline. That is really the first stages of Alzheimer's disease. This may include things like social engagement, mental cognitive training. It can be things such as exercise. It can be nutrition. All those things are now starting to point that they will lower your risk for Alzheimer's disease.
As we've heard, there's a lot of hope for where we're headed with Alzheimer's research. And one of the key ways to keep research moving in the right direction is through clinical studies. Let's take a look at the association service that can help you find a study.
Currently, more than 5 million Americans are living with Alzheimer's. By participating in clinical research, you can move us toward methods of treatment and prevention for all those affected by this devastating disease. Alzheimer's Association Trial Match is a free clinical studies matching service for those with dementia, caregivers, and healthy volunteers. To start, simply create a confidential user profile and receive a list of studies that may be a match for you. Don't just hope for a cure, help us find one.
Okay, that's going to bring us to the Alzheimer's Association services. The Alzheimer's Association is in communities across the country and provides direct service to individuals and families facing the disease. Oh, one too many. Get a little ahead of myself. Thank you for your patience. And so the association is available wherever and whenever you need information and support. On the screen, you see 3 of our key resources that can connect you with information and support. That includes 24/7 helpline, 800-272-3900. You can call anytime, day or night, to receive information and support. This provides access to highly trained and knowledgeable staff who can help with education, decision-making support, crisis assistance, and resource identification. Master's level clinicians are available around the clock to provide in-depth care consultations, a free of charge care navigation service offered to families at any stage of the disease. And help is available in more than 200 languages. Next is our website, alz.org. Often this is the first step for individuals following the diagnosis of Alzheimer's or another dementia. And it includes several specific sections specifically targeted. Excuse me, let me start that over, get my reading glasses in the right spot. Includes sections specifically for people living with the diseases at alz.org/IHaveALZ and caregivers for alz.org/care. And I'm going to share those websites with you in just a few minutes. And also we have the third one here is our community resource finder. There's a wealth of community-based resources available in your area, including long-term care, community-based services, local association offices, and their offerings of programs and support services. And they can be found at visit alz.org/CRF for Community Resource Finder. So before we go into the questions, I do want to take opportunity. I'm going to drag this over here for you. And what we're going to look at is some of the things in the 10 warning signs and in understanding Alzheimer's dementia in the abbreviated version. You don't see the portion where we talk about facts and figures, but there's going to be, let me get this in here real quick while we're these links into the chat box for you. So you'll be able to copy those out. You find out facts, information, quick facts about Alzheimer's. If you were having a conversation and you wanted some support, this would be a great place to start getting some information together. This is alz.org. This is the homepage. When you come, if you haven't been there yet, you can come in here. You can find a support group. Here's information about Aduhelm, approved treatment. What I like to point out here is if you're not sure, you can just type in the word of what you're looking for, and it can bring you up information that points you in the right direction. Also, translatable, and I've seen this work with Spanish and it was Mandarin. So there's a variety of ways to get the information to you. So if you have Alzheimer's, this is the one we were just speaking about, and I have Alzheimer's. This is a great page to get you what you can expect. You can get educated, were you just diagnosed? How do you share that? How do relationships change? So some great topics, tips for daily life. And this is if you are a caregiver, you come through and you can see what to expect from a caregiver's perspective, early stage, late stage, middle, the stages and behavior changes. We get you educational programs, caregiver health, support groups. So a lot of great stuff there for the caregivers. Now, when we look about where, I think there was a thing in the chat box there was talking about, is there a doctor up near Humboldt County? You may be able to find medical services, care at home, and partnership with AARP on presenting program and events. If you want to volunteer, there's a site. We talk about resources and volunteering, so there's a variety of information there. If you're an advocate, if you have a passion for advocacy, you could help by joining AIM. So they focus on trying to get the legislatures at the state national level to fund research for Alzheimer's disease and those issues that are important for Alzheimer's patients. I've addressed a little bit about clinical trials. So we have this page here. You can talk about trial match, just trying to get you into a trial program. What are they? How do they work? Why should you participate? And this one here is a big one. Why participate? Because it covers the demographics about the different groups that are at bigger risk. The more folks we can get in those pools will help provide the clinical trials, and maybe we can come up with a way to help folks. And this one here, we'll leave up for a minute because that one I'm going to turn over to Kim. So let's get into the questions. Let me go back up in the text line.
And John, one of the questions back way up there was, does Parkinson's cause Alzheimer's?
I do not believe that that does. I think they're two distinctly related, different diseases, but I am not a professional. I'm just going off of what I've learned over the last year and a half. I would encourage you to call the helpline and try and as a quick, see if you get a quick answer, or we can research that through ALZ, the Alzheimer's Association website.
And then another question pretty far up in the chat from Roland was, why has the frequency of Alzheimer's disease increased over the last few decades?
Now that's a great question. What I believe is, one, our older population, the baby boomers are getting older, so there's a bigger pool of folks that are in the potential to get Alzheimer's, and the research and development that has happened over the years to try and be able to diagnose, identify, has probably put more people into that pool than they would have had maybe, when my mom was sick 2.5 decades ago. So we had so a little bit above that question was more of a comment. Dr. Dale E. Brederson, author of the End of Alzheimer's, first program to prevent and reverse cognitive decline, published in 2017. So you can access the information via YouTube. So there's some informational thing. Thank you for sharing that. So I have a question. The FDA approved this drug against the advice of, that's the Aduhelm. So there's a much deeper discussion, and there was concerns about its effectiveness. There have been no drugs for anybody with Alzheimer's. FDA went that way. The panel didn't. There was some friction between those two sides. Alzheimer's individual spoke of constantly taking memory tests at his doctor's office. What are the tests? Do they show a sequence of several numbers, objects? I'm not familiar with what that test is, but my understanding is they give you the test and they repeat that test over a period of time and see if you're stable or if you're starting to slide in what you're forgetting to remember. That would be a great question to bring up with, if you have that concern, with your physician, with your medical personnel. Are there lifestyle changes other than the ones just mentioned, which I can follow? There may be, these are just some of the 10 basic lifestyle features that we talked about there. There are probably going to be more. Again, I would reach out, and because I'm not an expert, I got to put you to the experts, and I'll give you that helpline number again, 800-272-3900, and they may be able to point you in the direction of more stuff. You guys have some excellent questions. Dr. Michael Merzenich has written a fantastic book called Soft Wired that explains how to maintain brain fitness and develop Brain HQ as a brain training program. And he's got a website. Do you know if there's a link between having a history of depression and later developing Alzheimer's? And I'm not aware of any information on that. Again, if there was to get that quick answer would be the helpline, or you could explore through the Alzheimer's Association's website.
I believe there is a link.
Oh,
Certainly a correlation.
okay, thank you. Any known connections between Alzheimer's and Parkinson's? Okay, that one's that one. And then I have the links in there for you. So by the way, Tai Chi is very helpful for Parkinson's. Offering a class. Could you comment on the importance of caregiver support groups? I really believe strongly in taking advantage of the caregiver support groups. In my situation, I was here in California. My mom was back in Wisconsin, and she spent part of her time out here. Had we had those type of resources, the drain and the emotional toll on taking care of somebody who is slipping away over time, you need support, you need help, and you get where you have the same people going through the same things, and you can really gain a lot from there. So I would not pass up. If you're in that situation, please do not pass out that opportunity to get in the caregiver support group. A copy of the presentation, which will bring us to what I was going to talk about next. I paid for this segue.
John, real quick before you get moving forward, somebody sent a question directly to me. It says, I heard that nutrition and exercise can slow down progression, example, early onset. I'd like to hear more specific explanation on what regarding diet, exercise, that kind of thing.
Okay, so there's actually a presentation, Healthy Living for Your Brain and Functioning. And what we talk about in that one is you want to eat right? You got to take care of your health, your vascular system, the blood feeds the brain, 25% of each heartbeat goes to the brain. So if you have issues with high cholesterol or vascular disease, that could create issues for you. Exercise is excellent because you're going to keep your body in good shape. Walking, biking, things that you do, want that social aspect too, so you can have that. When we talk about COVID and the shutting down and being isolated, you know, it's one of the things is like, I don't feel comfortable getting to the gym yet because of the COVID that we have in Sacramento County. So, you know, you lose the social aspect of that. It makes it much harder to maintain my routine for me personally. So, yeah. So we're going to talk about these presentations. So in the link that I sent you, you will have the presentations for understanding Alzheimer's and dementia. You have a participant's guide, which we'll go through here. It covers the slides, the information that you saw on the screen today. And we have understanding Alzheimer's. It's not allowing me to pull up, but you'll see you have information for the understanding Alzheimer's and dementia section. And the 10 warning signs. Again, the presentation that we had, you have a participant's guide version there. 10 signs worksheet. This can be very helpful for you. So if you print this out and you're looking at, if we talk about doing the assessment things, you can use these tools. That's about the Alzheimer's Association. 10 steps to approach. Here we talk about assessing the condition, so you can take some notes. It's another one for the 10 warning signs. I'm afraid if I open it up, it's going to bog down. So I hope you just allow me to do the preview. Unless you have a specific want to see one, I'll open it up for you. Evaluating memory and thinking problems. It's a little sheet for you there. Some of the things we talked about. So any other questions before I turn it over to Kim?
Are you planning to put those in the chat? Those-
They are in the chat, or I put all the links in there. I'm gonna paste them in there again, so they'll be fresh right in front of you. When I recopy them, because I'm so good that I just took the last stroke away from using my keyboard versus my mouse.
Make
So
sure
I just dropped all these links in for you. The first up the top, the first two will be should show you there. There you go.
I don't
Back.
see them in the chat, John. Are you sure that you're putting them to everyone?
Oh, I had it inadvertently had Aaron Rao.
Aaron, you got them all.
Aaron, you are special in the book today.
Thanks.
Let's try this again.
There we go. I see them.
Okay, thank you for that, because apparently I clicked and tapped and didn't see that Aaron was my favorite attendee today. So you have facts, and then they're labeled. So this one is about facts. Here's the Alzheimer's Association and things like that. You should have them all.
Yep, they're all in there now. Thank you.
You bet. Thanks for letting me know about that. Okay. So how about I turn it over to Kim? If any other questions come up, we'll hang till the end, and then we'll be able to go from there.
Hi, let's get.
Do you need the screen, Kim? I'm sorry, I made the assumption.
That's okay. There we go. All right, sharing my screen here. Kim Coelho, Community Engagement Manager for the Alzheimer's Association. I work here in Humboldt County out of my home in McKinleyville. So it's a part-time position most of the year. Right now it's not because of the walk, so I'm pretty busy. But one thing I want to mention that John had commented on, Trial Match. Trial Match is wonderful. So it's for folks that want to get in clinical trials if you do have dementia, but it's also for folks that don't have dementia. It's wonderful. So I signed up for Trial Match, and by filling out the information, how old I am, I'm signed up for a study where quarterly they will send me a survey that I can do memory test, which is great. They keep track of the information, and then another quarter goes by and I do another one. So definitely check out Trial Match. So let's get on to the walk. Okay, go down here to advance my slide. All right, so this will be the sixth walk to End Alzheimer's for Humboldt County. In addition to being a fundraiser, this event brings awareness of the disease and helps take the stigma away. So locally, we estimate we have about 3,500 people between Humboldt and Delaware counties that have Alzheimer's or other dementias. So this event means so much to people with the disease and their families. So they're so grateful when they come out to the event to see so many people turn out. It gives them hope that one day we will have a survivor. So what is the Walk to End Alzheimer's? So this event takes place not only in our community, but in 650 communities all over the country. So John's from Sacramento, his walk is happening this coming weekend. So Walk to End Alzheimer's is the signature event of the Alzheimer's Association. It plays a significant role in helping the association advance its mission. So for a second year in a row, the walk this year again is everywhere. It's on every sidewalk, track, and trail. Your health and safety are a top priority. So for year two, we aren't having a large in-person gathering like we normally would do at the Adorney Center. So instead, we invite you to walk in teams of friends and family, while others in your community do the same. So this was last year. It was wonderful. So folks had to walk from home because of COVID, but they did, and they sent me pictures. I loved it. So you can see people all over the county, Philbrook, Eureka, Fortuna, McKinleyville, Arcata, Trinidad, Realdale, Scotia, all over the place. They were out. So they had their mask on if they needed to, with their friends, family, coworkers. So it was pretty cool that they got out and walked. So, because it's not easy to try to hold a fundraiser when you tell people just to go out your front door and walk. So, but they did it. So, starting a team. So we need folks to sign up as team captains if you want. So you can visit alz.org Humboldt, or you can just Google Humboldt Walk. So I'll put a, when I can get back to the chat, I'll put a link in there. So you choose a team name. ask friends and family members to join you. There's no fee to sign up. Teams can be any size. You can be a team of 1, you can be a team of 100. So we don't care. So the association provides coaching and tools to help you meet your fundraising and recruitment goals, including easy ways to fundraise online. So there's no minimum, and we do get a certain amount of folks that sign up that don't raise funds, and that's okay too. So we just really want people to be part of this event and start the conversation with their family and friends. So let's see. So if you don't want to start a team, you can join a team. So you can register, you can join a team or register as an individual. So one team that is always looking for team members is Visiting Angels. So they're in a national competition with other Visiting Angels team. The top 10 teams from Visiting Angels will be credited with incentives ranging from $35,000 down to $10,000 for 10th place from the Visiting Angels CEO. So our Visiting Angel teams is wonderful. Lynn McKenna's on the call today. She's part of that team. And the last few years, last year, we got a $10,000 incentive that goes directly to the Alzheimer's Association, gets credited to their team, but obviously just benefits the Alzheimerers Association. So, and the year before, we got an incentive in the year before. So if you'd like to help out the Visiting Angels team, that would be great. Down below is you can, if you go to our website, you can type in Visiting Angels and find their team. So what happens the day of the walk? So the day of the walk, we're gonna, anytime you want to walk, you can. You watch the online opening and promise garden ceremonies on our website. Then you go take a walk in your community. If you have your walk gear, you wear that, and then you walk with a promise flower. So team captains can request flower for each member of their team. The flowers, I'll be out delivering them the week of the walk, which is coming up on October 9th. So what the flowers are so normally when we meet together for the walk, we have this really nice promise flower garden. They're made up of 4 different colors, the flowers. So when every participant gets a flower. The yellow flower is given to folks that are caregivers. Purple flowers are those that have lost someone to the disease. Orange flower represents supporters and advocates for a world without Alzheimer's. The blue flower is given to those that currently have Alzheimer's or other dementias. And the white flower, this is the one flower that represents the first survivor of Alzheimer's disease, which we will get there. So we ask people to go visit one of Humboldt County's view-only promise gardens. Well, actually, they're not even view-only this year. They're there, and I'm going to be giving flowers out ahead of time so you can walk by the garden and you can plant your flower in that garden. So I'll show you a picture of what I'm talking about. So this was last year. These were the different gardens that were out and about from all the different communities. So we had them at post offices, in front of the courthouse, up in Trinidad by Katie's Smokehouse. It's just wonderful. People love going by. The flowers, once they get going in the wind, they just spin around. They're pretty eye-catching. It was really nice last year with COVID and everything so dark, with everything going on in the world, to drive by one of these promise gardens. So we've got lots of tools to make it easy. One is the Walk app. So for your either iPhone or Android. So it allows you to track your fundraising progress. You can send text messages asking for donations, manage your Facebook fundraiser, and even deposit check donations you've received. So traditionally, participants who use the app raise 3 times more than those that don't. The app helps track your steps on walk day, along a virtual path if you want. And one new thing they've added to it this year, which is pretty cool, is there's a virtual promise garden. You can go on the app, select your flower, color your flower, and you can personalize it and then plant it. So, and then we mentioned the Facebook fundraiser. This is wonderful. It's a great tool. It's very easy. Folks are so giving. So most people really appreciate that people are involved with this event. So, you put it up on Facebook. The main thing with the Facebook fundraiser is once you sign up for the event, you have to go to your participant page to start this Facebook fundraiser. So if you don't, then the money goes to the Alzheimer's Association, but doesn't go back to your team. So you really want to go through your participant center. So I just want to mention Edward Jones is incredible. So in CVS Health, there are 2 national presenting sponsors. Edward Jones has been on board since 2016. They've committed 25 million over the next 5 years. A lot of their clients are facing Alzheimer's or other dementias, so they definitely thought it was important to get involved. So CVS Health, this is their 3rd year as a national team program. So in 2019, CVS made a 3-year commitment of $10 million. So, and then here's our wonderful local sponsors. So, you know, I encourage, if you guys are out in the community doing business with any of these folks, just thank them for supporting, you know, the Humboldt County Walked Into Alzheimer's. So, all right, I think that's it. I'm gonna stop sharing my screen here. And I can take questions as well as John. And I'm gonna go ahead and put the link here for the walk. And anyone have any questions? Please explain trial match. I wish I had the link right now to put in the chat for you. If you go to alz.org and type in the search bar trial match, it will pull up the information about it. So it is true. It is really, really wonderful. So once you do that, it'll tell you all about it. So it's basically, you can look for different clinical trials to be involved with. So whether you have dementia or not. So like I said, you put in your information, especially once you get past 50, which I am, then there's a lot more studies available for you. A lot of memory tests and stuff. So, and it's great. You can be part of the cure. So,
Kim, it is in the chat. We did get that link in the chat.
Oh, wonderful. Thank you.
Yeah.
And Lynn, in the chat here, if you're interested in either joining Visiting Angels, or you're interested in the joining the AIM, which is the Alzheimer's Impact Movement, Lynn, if you give her a call, she'll go ahead and send you the form. So, and thanks for putting trial match in there.
I also want to let people know that the brochures that he showed you online, we actually have hard copies of those. We also have them in Spanish, and we have made outreach to several of the Hispanic groups in the community around here and gotten the brochures to them. The underserved populations tend to shy away. They're not comfortable going to doctors or seeking, medical help for any problem. So if you know anybody in one of those groups and they're experiencing difficulties, please try to encourage them to seek some medical help or to contact us, and we can get some information to them.
Thank you, Lynn.
Jane?
Yes, I'm curious as to, I know you only give recommendations regarding clinical trials, in essence, that have proven certain results. But I'm just curious as to why you don't mention things like Dale Bredesen's work, or David Perlmutter's work, or things like Michael Merzenich. I put that information in the chat. But there's a great deal of information written about prevention, keeping your brain alert. And I don't know whether you address that in any of your presentations. I know you mentioned you have a presentation on lifestyle and health. Is that a totally separate presentation that you could give one of these days?
Sure. I mean, that's healthy living through life and brain. It's about an hour's presentation. It goes into some of those factors about the importance of health, getting exercise done, the social aspects. This program is kind of a informational very general information. So this is working off what the Alzheimer's Association has built for us. If you have inputs that you think might be helpful, if you want to forward them, we can see if maybe they can build those in. They will screen it and see, they feel that that's appropriate for the message that they're delivering. I mean, we could include those as well.
So that's a presentation you could potentially do, say, in the spring session?
Yeah. I mean, I run 3. I do the 10 warning signs, understanding Alzheimer's, dementia, and healthy living, free life and brain. So those are 3 that I do. There are others that the association does present, but those are the 3 that I cover.
Thank you.
Erin also has a question.
Yes, Erin.
Hi, thank you. I am wondering if there's any evidence that crossword puzzles and all these like little name games on your, that are of any value.
So, and what I've been told is that they are of value, but the biggest thing, rather than like, if you just do crossword puzzles every day and you don't do anything else, then it'll have a certain value, but the best value is if you just learn something new all the time. That is the biggest, keep your brain engaged, so. And I agree with you, Jane, that health is so important as far as the diet and exercise. Huge studies on how important that is, because they've realized that what's important for your heart is important for your brain. So, you know, all the stuff they've recommended for your heart to keep healthy, you need to do the same thing for your brain as far as your diet and exercising and being social. So social connection. So it's so great that so many people are part of this OLLI presentation and you guys are learning something new. So you're on the road.
Exercise piece is important, but just simple walking can really reap benefits for you.
Definitely.
Any other questions for Kim or John today?
There's a question. Is there a speaker available who could answer the more detailed or technical questions that today's speaker couldn't address?
I have to refer to Kim.
Yes, most definitely. So I could definitely, let's see, if you guys could forward me these questions, I could definitely get the answers and follow up with the participants. So is that possible, Jane or Kim?
Yeah, I'll save the chat so that.
Okay, that would be great. And then I could respond back if somehow I could. I'm not sure how I get their email addresses or whether I give you guys the answers and then you respond back to the members. But I could definitely, if you give me the chat, I could definitely go through every single question and get answers for the participants. So
thanks, I'll keep in touch with you.
Sounds good.
I do see there was, are there any local support groups in Humboldt? And I would say, I don't have that. If we go back to the link that had support groups, then you could look at that or the community resource finder.
Go ahead.
Is it correct to say that although there's no cure for Alzheimer's, it is proven that you can slow down the progress of it?
For a while.
With the new drug for early onset, that's what they're looking at. So, but just for the early onset, the folks that are in the very beginning, early stages of the disease. So.
I'm sorry?
For the folks that are in the early stages of Alzheimer's, there is the drug out now that's, how do you pronounce that, John? Aduhelm?
Aduhelm is the commercial name. That's a little shorter for me, so I get that one a little better. Canamab.
So that drug is, but you have to go to your doctor and the doctor has to look to make sure that you're a candidate for that drug before they prescribe it. So.
Okay.
And it's an IV infusion, I believe.
Yeah.
Yes,
Not a pill. So
Yes.
it's an IV infusion that you get every so often. I just want to comment on the controversy with approval of this drug. It's like any other drug that's out there for cancer or any of the other diseases that are having ongoing research. It's up to you and your doctor to take this drug or try it. And so the fact that it's available just means that it's out there. And if you or you know somebody with early onset and you're interested in this, process, we did have a former member of our committee who just passed away earlier this year, and he was on a clinical trial study down at Stanford and was taking some of these drugs, and they did give him a better quality of life for a year to a year and a half. So again, it doesn't cure the disease, it doesn't stop it, but it can slow down that initial process, which in turn gives you time to plan, to make arrangements with your family, to have a plan in place for as the disease progresses, what step is coming next, and you're prepared how to deal with it rather than being blindsided. So again, like with any medication, it's your choice and your doctor's recommendation for you to take or try this drug. And we know, like with cancer, sometimes the medication doesn't work. So it's not a cure-all for everybody, but it strictly should be your and your doctor's, your physician's decision to try these drugs.
And side effects?
They vary from person to person, like with any drug.
I see.
Again-
Go ahead. Go ahead. Lynn.
Again, your doctor, should know what the potential side effects are. And some people are more susceptible to side effects and others aren't. So it's an individual cases.
So there's a question in the chat if someone can spell the name of the drug, and then also Erin has another question.
Do you know how to spell it, John?
I'm pulling that back up.
Okay.
All right. In the meantime, Erin, go
I'm great.
ahead.
I'm hearing the words, I'm hearing the importance of early detection, and I'm hearing you and your doctor. I'm hearing the word doctor, and I've mentioned this a few times in the chat. We don't have any doctors in this county. Do you have any suggestion for how?
Dr. Lear is a geriatric doctor.
Oh, there is one in Eureka?
Yes.
Okay, great. One for the whole county.
Yes.
It's a tough road to hoe. We have that problem everywhere with physicians in our county. But you can also, discuss this with your primary care physician. And if you have concerns, you can be referred to a neurologist, and a neurologist can take it one step further.
And is there a neurologist in this county?
Yes, there's 2 or 3.
Oh, great. Okay, that's good news.
So the spelling, aducanumab, I can't say medical stuff very well. ADUCANUMAB.
Can you put that in the chat?
Absolutely.
Thank
that is you're life learning right here.
I'm a visual learner.
If the answer, if there was the answer to the support group. So I know Doug Durham, who's on the call today, used to run a wonderful support group here locally. I'm not sure what's going on right now because of COVID, but I do know we do have online support groups. So if anybody's ever interested in joining an online support group, I know that's not as nice as being in person, but it's still support. So do you know, Doug, if there's any right now?
In the Humboldt Senior News last week, they mentioned 2 caregiver support groups, but you can call the A1AA or the Senior Center, and they will be able to help you, or Redwood Caregivers.
Wonderful.
One of those 3 places.
Great.
All right. I don't see any other questions. Anybody? Last chance.
Well, thank you all so much for attending today, and we hope we've answered any number of your questions. And I want to thank the speakers for taking the time and doing such a great presentation, and all that you do in order to help end Alzheimer's. And suggest that next week, if you want to come back, Michael Fields is the theater director for a presentation on a life in the theater. And I think you'll find that very exciting because he has a whole new adventure. So I look forward to seeing you again. And as was said before, feel free to send questions to Kim Laney or to Kim Coelho. Did I kill that pronunciation?
Nope, that's good. Kim Coelho, that worked.
There's hope. All right, thank you so much. We'll look forward to seeing you next week.
All right, thank you.
Thanks everybody for being here. Thank you to our presenters and our volunteers. We're really happy that you joined us today, and look for the recording in the on the OLLI website, probably either later today or tomorrow.
Thank you.
Thanks, everybody.